As of July 24th, the US has confirmed more than 4 million COVID-19 cases. That means 1 out of every 100 Americans has tested positive. Its death toll now tops 140,000, accounting for a fifth of the world's total, more than its toll from the First World War. The rising numbers could just be the tip of the iceberg. Experts have often warned infections could be around 10 times higher than what is reported, as many still go untraced. While most European countries have flattened the outbreak curve, the US also flattened the curve, but in a different way. Behind all these rising numbers lies a question worth exploring. Why did America lose the war on COVID-19? 4 letters, SICC. Let's start with the first C, contempt of science. Although it is absurd, Americans are still debating about the validity of mask wearing.
You literally cannot mandate somebody to wear a mask knowing that that mask is killing people.
Everybody cough in my face! Do it!
Some in the US don't take social distancing seriously.
Lockdown basically is slavery.
Open up! You don't have a right! You cannot do this to people!
This contempt, or neglect of science, or however you want to put it, seems to be the symptom of American individualism, a national culture that values freedom more than anything, even their health. And don't forget the series of astonishing instructions coming directly from the White House.
Right, and then I see the disinfectant by injection inside or almost a cleaning.
Now we have tested almost 40 million people, 99% of which are totally harmless.
I'm taking it, hydroxychloroquine. I say, hey, you know the expression I've used, John? What do you have to lose?
Your vice president, who today was the only one at the Mayo Clinic seen not wearing a mask.
The president has said unmistakably that he wants schools to open. The science should not stand in the way of this. And as Dr.
I means insufficient leadership. When faced with catastrophes, people often expect someone to stand up and show a clear way out of the predicament. However, in the process of responding to COVID-19, US leadership seems to be doing the opposite.
Typically that will go away in April.
It'll go away. It's like a miracle. It will disappear. It'll go away. It will go away. It's going to go away.
Over 1 million.
And 2 million cases of the coronavirus.
The U.S. marks 3 million COVID cases and counting.
Of course, the U.S. remains the world leader in the pandemic.
What?
It almost goes without saying.
It has replaced it with repeated misinformation.
You know, testing is a double-edged sword. So I said to my people, slow the testing down, please.
Continuously blaming others.
Chinese virus.
The Chinese virus.
Kung flu.
A bill has to come due from China. It's not a question of punishing them. It's a question of holding China accountable.
You are getting so good at this. I'm wondering when you go back to Irvine and a student
and making political calculations for the election.
President Trump backed their calls. In a series of tweets, he exclaimed, "Liberate Minnesota, Michigan, and Virginia."
Our country wasn't built to be shut down. America will again and soon be open for business.
The second C stands for cleavage of society. Any attempt to contain COVID-19 in the US will have to address its potential spread in low-income communities of color to protect the lives of people in those communities. But official data indicates African Americans are disproportionately targeted. As of July 8th, among all the deaths of COVID-19, 23% of them were African Americans. However, African Americans only make up 13.4% of the US population. In some areas of the country, the disparity has been even more striking. In April, reports from Chicago said African Americans made up 72% of people dying from COVID-19, although they only compose a third of the population there.
It will end. We will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community.
To make things worse, Black Lives Matter protests have spread across America since the end of May. As of July 3rd, protests have occurred in over 40% of the counties, with more than 15 million people participating, which make these demonstrations one of the largest in US history. Many protesters did not wear masks properly, and social distancing could not possibly have been carried out. These made flattening the curve mission impossible. S stands for system flaws. America's failed response to COVID-19 is largely a failure of its own system. First, the political decentralization system in the United States has become a burden in epidemic prevention. On one hand, the federal government and the states compete for medical supplies such as masks and ventilators in the market. On the other hand, buck passing and throw it over the wall are games they like to play. Second, over the past few decades, Republicans and Democrats have become increasingly geographically divided. Democrats tend to do best in the nation's urban areas, while Republicans find their strongest support in more rural areas. However, in the US Congress, every state gets the same 2 senators, regardless of their population size. This Senate map had particularly negative consequences over the past several months, because COVID-19 hit Americans' urban population centers first and hardest. In early March, for example, as the virus was spreading, the first 15 US states to report cases accounted for 56% of America's population, but only 30% of America's senators. This explains why the Senate was initially slow to act. Finally, the power of corporations has been translated into political power with disastrous effects to people's lives. The total money spent on lobbying Congress and federal agencies rose from $1.45 billion in 1998 to $3.47 billion in 2019. Given corporations' growing clout with policymakers, it is hardly shocking that business groups were able to convince the Trump administration to delay and scale back the use of Defense Production Act. It is a tragedy that the US government has lost the war against COVID-19, and the American people are suffering because of it.